1. Could the U.S. eliminate health warnings on HRT? 2. FDA chief. HRT warning may be one of the greatest mistakes. Menopause therapy debate explained. 1. Could the U.S. eliminate health warnings on HRT? The United States may be on the verge of eliminating health warnings associated with hormone replacement therapy, HRT, marking a significant shift in how menopause is treated. This potential change is being discussed in a panel convened by the Food and Drug Administration, FDA, on Thursday afternoon, which includes several advocates for HRT. The central question is whether the current federal guidelines exaggerate the risks that women face when using this therapy. At present, HRT and other estrogen-based treatments carry warnings indicating that they may elevate the risk of serious health issues such as strokes, blood clots, dementia, and breast cancer. Furthermore, these treatments are not recommended for the prevention of cardiovascular disease or dementia. However, Dr. Marty Makary, the head of the FDA, argues that the perceived risks of HRT, which is commonly used to alleviate symptoms like hot flashes, are overstated. He believes that the advantages of HRT are overwhelming. Dr. Makary stated, "For decades, hormone replacement therapy has been instrumental in helping women manage menopause symptoms, including hot flashes, dryness, mood swings, weight gain, and sleep disturbances." He also pointed out that initiating HRT 10 years prior to menopause could potentially lower the risks of cognitive decline, Alzheimer's disease, osteoporosis, and cardiovascular issues. Despite these claims, there is no opportunity for public input during this panel discussion. Dr. Makary attributes the decline in HRT usage to a clinical trial from the early 2000s that was halted due to reported increases in breast cancer and stroke risks. He contends that subsequent studies have not replicated these findings. In a previous podcast, he controversially stated that there is no medication that improves the health outcomes of a population other than antibiotics, a claim that has sparked debate within the medical community. Critics of the panel have raised concerns that it consists of several physicians who share Dr. Makary's views on HRT, and they lament the lack of public commentary opportunities. Diana Zuckerman, president of the National Center for Health Research, remarked, "This is not like any other public meeting held by the FDA in the past. No one in the audience is being allowed to speak or ask questions," highlighting that most attendees seem to have a favorable opinion of hormone therapy. The FDA's event description states, "Hormone replacement therapy has long been a vital treatment option for women to ease menopause symptoms, among other potential health benefits. However, over the last 20 years, HRT has been clouded by confusing narratives regarding its risks. Recently, the American Journal of Physicians published an editorial asserting that HRT offers limited benefits while posing significant risks. The authors concluded, "Menopause is a positive life experience for many women and should not be medicalized." This ongoing debate raises important questions. Should we reconsider the way we approach menopause and HRT? Are the benefits of HRT being overshadowed by outdated fears? We invite you to share your thoughts in the comments below. 2. FDA chief. HRT warning may be one of the greatest mistakes. Menopause therapy debate explained. Imagine a medical warning so severe it's kept millions of women from life-changing treatment, only for top health officials to now call it potentially one of modern medicine's biggest blunders. That's exactly what FDA Commissioner Marty Makary suggested about the ominous black box warnings on hormone replacement therapy, HRT, for menopausal women. Speaking candidly after convening an expert panel this week, Makary told News Nation the dire labels overstate risks while ignoring proven benefits, a stance that's sparking fierce debate across the medical community. Here's the core controversy. Those bold black box warnings plastered on estrogen-based menopause treatments have long warned of terrifying dangers like breast cancer. But Makary insists current medical evidence doesn't support such alarmist messaging. This may have been one of the greatest mistakes of modern medicine in the last 25 years, he declared, calling the warnings remnant dogma that's robbed women of HRT's advantages. And this is the part most people miss. When started within 10 years of menopause onset, HRT doesn't just ease hot flashes and night sweats. It actively reduces long-term risks of osteoporosis and fatal heart attacks. Makary passionately argued that we've failed to see the forest for the trees by hyperfocusing on rare risks while overlooking HRT's protective benefits for most patients. His hand-picked panel experts unanimously challenged the existing warnings too, though critics might ask, is it appropriate for the FDA chief to hand-select advisors who mirror his views? The commissioner notably pushed back against taking public comment despite audience requests, prioritizing swift action instead. Now consider this counterpoint. Should we really scrap critical safety warnings when some studies still show breast cancer links? Or does clinging to 20-year-old fears actually endanger women by denying them protective care? Share your take below. Do you side with Makary's urgency for label reform? Or does this feel like a dangerous rush to judgment?